We're really designed to be nasal breathers. Our nose is meant to warm, filter, and slow our air. Thank goodness that we have a backup option. We can breathe through our mouth, but we're not designed that way. When we bypass all those natural functions, there are consequences. If the air is not filtered, that's just going to cause a lot more inflammation. It's going to dry out the oral mucosa. There's a lot of reasons why we might not be breathing through our nose. One of them is that there's a nasal blockage or deviated septum, but there are other reasons too. There might be allergies on board, there might be enlarged tonsils or adenoids, or another reason could be that there is a tongue tie. Or really there are studies also that show that you can be breathing through your mouth because as a child you see other people breathing through their mouths. And that's why a detailed evaluation is important, so we can kind of determine what those contributing factors might be in that case, because it's not going to be the same for everybody. If we're not able to breathe through our nose, that can have a few different effects. One of them is that the tongue is going to be sitting low and back, and that tongue is going to be physically blocking the airway more. It also increases the resistance that our air has to pass through that path, and that can cause something called upper airway resistance syndrome, which is just a prequel to sleep apnea. Sleep is really important during development because that's when we're growing and our brains are 90% developed by age 4, and that's when our body is meant to detoxify. That's when we're forming our memories, and that's when a lot of our hormones are released. So if we're not able to get quality sleep, REM sleep, then those normal health processes that are supposed to happen during sleep just can't.